So tennis elbow, usually seen in primary care. And the first thing, like any other condition, is to make sure that the diagnosis is correct. So I encourage anybody who sees tennis elbow to assess the patients properly to make sure it is the tennis elbow that is actually causing them the pain. Once we've confirmed this, the mainstay of treatment is actually physiotherapy. Most patients don't require anything else. And over 90% of the patients with good physiotherapy will have complete resolution of the symptoms of tennis elbow. Now, I tend to see the tip of the iceberg that has usually failed rehabilitation, i.e. physiotherapy. And in those cases, my job is to further assess the tennis elbow. So I tend to get some imaging to confirm whether there is a significant tear of the muscles around the elbow or not, and then to formulate a very specific plan for the patients. Fortunately for patients, it still requires physiotherapy, but there's some things that we can do in addition. Now, surgery is very rarely required. I mean, I see a lot of tennis elbow, and like I said, I see the difficult ones that I have not resolved. But even in my practice, less than 8% actually require tennis elbow surgery. So in most cases, I tend to send patients for further specialist physiotherapy, as well as certain kinds of injections. Now here is where we mentioned that steroid injections are a bad thing for tennis elbow. It has been proven that if you give steroid injections to tennis elbow, in most cases it will not help. And this data is going back many years. So I highly recommend that as a treatment option, steroids are not considered for tennis elbow. If you do give steroids to tennis elbow, you will find that your patients actually do brilliantly well for a few months. But a lot of them will come back, and unfortunately, we have found that they tend to come back with symptoms and a tendon which is worse than it was before the steroid injection. And that makes sense because tennis elbow is an injury to the tendon, and all the steroid is doing is taking the inflammation away, but it's also stopping the healing. So please stay away from steroid injections. Now, the other things that can be done for tennis elbow, and there is excellent evidence that tennis elbow that has not resolved with just therapy alone can be helped with a different kind of injections. And the one I like to use is called PRP, which is an acronym that stands for platelet-rich plasma. And there is fantastic evidence for this. And what happens here is we take the patient's own blood in the outpatient setting. So you come to a clinic, patient's blood is taken, just like a blood test. Then it's put in a special machine where it's spun really fast. And what it does is separates the blood into all the good growth factors away from all the bad stuff that cause inflammation. And then we take that concentration of growth factors and then we inject it exactly where the injury is to encourage healing. And this, in those patients that physiotherapy hasn't helped by itself, is a very good option for tennis elbow.